Good morning, everyone, and thank you for allowing me to join you today to formally introduce a new health education program through Calaveras County Public Health, the Healthy Aging Program. To orient ourselves to what the Healthy Aging Program through Calaveras County Public Health aims to do, let's start with our mission statements. The mission of our Calaveras County Public Health is to improve the health and well-being of everyone in Calaveras County. Our department meets this mission through health education programs, clinical related services, and an emergency preparedness team. The Healthy Aging Program is a relatively new program within the health education team that aims to provide opportunities and resources to older adults to improve health and quality of life through outreach and collaboration with various local community partners. While aging is the dedicated focus of the newer program, I want to zoom out for a moment and showcase how the Healthy Aging Program fits within the wider range of essential public health services offered through Calaveras County Public Health. As you'll see, each program strives to reach underserved groups to address population level health needs in our community. We oversee a breadth of programs promoting wellness and equity across the lifespan, from maternal and child health services like our Baby and Me program, to health education staples like the Tobacco Cessation Program and our Oral Health Program, to clinical offerings such as community immunizations and investigatory programs monitoring communicable diseases. Our diverse public health team works tirelessly to cultivate equitable conditions for the health and safety of all who reside in Calaveras County. So this information is also on those ginormous business cards that I'll have around. The Healthy Aging Program is so new, it's not on there yet, but it will be. So the Healthy Aging Programs joins this suite of targeted programs designed to address specific community needs. So as we all know, population aging is a growing priority both globally and in California. By 2030, projections indicate adults over 60 will represent 1/4 of the state's population. To prepare the infrastructure for this demographic shift, California published a master plan on aging in 2021. One of these plan's goals is promoting health and well-being across all communities by increasing relevant public health programs and interventions. Here in our county, the aging of the adult population and the need to strengthen senior services is already an established reality rather than just a future prediction. Over 1/4 of our county residents are already over the age of 60, according to our census. Supporting positive aging outcomes across the lifespan through public health education is an imperative for the sustainability and the health of our community. To address this recognized need, the Healthy Aging Program has 4 key priorities guiding efforts to support older adults in our community: social isolation, support for caregivers, health education to improve health literacy, and the formation of strong partnerships with other agencies to maximize our impact and improve the health of our community. So social isolation, that's a big one. The United States Surgeon General, Dr. Vivek Murthy, issued our Epidemic of Loneliness and Isolation, the Surgeon General's Advisory on the Healing Effects of Social Connection and Community, which highlighted the public health crisis of loneliness, isolation, and lack of connection, emphasizing the significant impact on mental, physical, and societal health. This advisory reported 1/2 of adults in the United States reported experiencing loneliness. The physical and mental health consequences of poor or insufficient connection are profound, including an increased risk of heart disease, stroke, dementia, depression, and a higher likelihood of premature death. Older adults are at an increased risk for loneliness and social isolation because they are more likely to face factors such as living alone, the loss of family and friends, chronic illnesses, and hearing loss. 1/3 of adults aged 50 to 80 reported infrequent contact, meaning once a week or less, with people from outside of their home in 2023. So we know loneliness and social isolation represent profound threats to the health and well-being, necessitating intervention to address this public health priority. So what we're trying to do, the Healthy Aging Program will pilot a social isolation intervention consisting of community-based social gatherings for older adults hosted across 7 towns in our county. This pilot series will provide light refreshments and facilitated discussions led by yours truly. The goals of the initial gathering are twofold. First, to allow older adults to foster meaningful connections with peers in their immediate community. And second, I'm hoping to receive direct input from the older adult participants on desired activities and guest speaker topics, which will help me inform future gatherings. Centering the priorities and interests of older adults themselves in designing this initiative is going to be key to its success. So following this pilot phase, the Healthy Aging Program are going to analyze metrics such as attendance rates and the post-survey feedback assessing the level of meaningful engagement and connection. And based on these indicators of success, 4 of the 7 locations demonstrating the highest need and engagement will be selected for ongoing social gatherings as part of a relaunched version of the social isolation intervention. The primary goal of this piloting the initiative is to thoughtfully tailor the intervention for our uniquely diverse community and make an informed decision on how to maximize the accessibility and sustainability. This pilot is going to be offered in San Andreas, Copperopolis, Railroad Flat, Valley Springs, Angels Camp, Arnold, and West Point. And I have flyers that have all this down. That'd be fun. Yeah. Because she has a lot of little flares. Yeah. While our Rural Oasis Social represents an initial flagship effort to reduce isolation among older adults, we have other priority areas still in earlier phases of development where partnerships will be key. These highlight some of the other critical needs affecting older adults that our programming aims to address over time through community collaboration. 1, we recognize informal caregivers play an incredibly important role in enabling many of our community's older adults to age safely in place. These caregivers devote immeasurable time and energy assisting with daily activities and health needs. To support caregivers' invaluable contributions, the Healthy Aging Program aims to provide structured assistance where we can. We are in the early stages of planning a toolkit to aid caregivers navigating their role, as well as self-care recommendations and exploring training workshops and peer support networks to educate and connect caregivers throughout the county. Furthermore, equipping older adults directly with accessible knowledge to proactively manage their own complex health conditions and navigate a complicated healthcare system is vital for their continued independence and well-being. We are in early phases of developing plain language educational workshops and distributing materials to address how low health literacy affecting healthcare navigation and self-care skills. Sample topics could cover managing chronic conditions, properly using medications, applying for benefit assistance programs, and more based on the needs voiced by the community. And we also welcome all of your input on pressing knowledge gaps experienced by the older adults you serve. Finally, connecting strategically with other organizations and agencies serving older adults will allow us to maximize the reach and impact of everything we wish to accomplish through the Healthy Aging Program. So we cannot achieve our ambitious goals in a silo, and we wholeheartedly welcome potential collaborations focusing on any aspect of helping our older neighbors age well with grace, health, and sustained quality of life. So please reach out to brainstorm specific initiatives that we might undertake together, leveraging the strengths of both our public health and your invaluable organization. That's a whirlwind. It has been a pleasure speaking with you all today and getting to further introduce our efforts through the healthy aging programs to meet the needs of our growing older adult population. So please connect with me directly to strategize program activities that collectively strengthen our aging services infrastructure across our county. I also want to reiterate my deep gratitude for the work that you already all do to uplift the lives of older adults in our regions. And you're inspiring my efforts as I create this program daily. So thank you again.
Thank you.
Yeah.
Can I get a picture of you doing that?
I don't know if that's organic anymore.
Perfect.
All right.
Question.
Yeah, please.
How is this initiative funded?
So we are funded through a grant called Future of Public Health.
Okay.
And we received that during COVID, and it's somewhat flexible. So our department was able to identify areas that they wanted to use that money to strengthen our department. So we used it to fund an epidemiology and informatics team, as well as a senior health program.
Okay.
And so that's where I came in.
Any other partners adding money to it, or like the healthcare district?
Right now, it's we're using the FOPA grant to
Okay.
build the program up.
Right.
And after we have a really strong foundation, we'd be a lot more open to other funding streams.
Yeah.
So what about if you talk to Nancy and had her bring the bookmobile to one of your gatherings?
See, that would be fun. Yeah.
Because they've got technology in there too that you could use.
Oh, I haven't even looked in there in a minute.
Oh,
I've-
yeah, it's, they've got a TV screen, they've got a computer.
Mhm.
I'm not quite sure what the function is for, except for I think it's just so that when they take the bookmobile out, if they do have somebody that needs that
Mhm.
resource, they also have it in there.
That's
You could
nice.
talk to her
Yeah.
about it. I mean, I think it'd be great because you could have your social gathering. They could all go and find books. They could come
Mhm.
back in and talk about the books they
Yeah.
bought or their favorite author. I mean, it might stimulate some
Mhm.
conversations.
Yeah, so that's kind of what I hope to get from the pilot is hearing what people want to do. Like if they feel like they'd like the event more if it was a book club, or if they wanted to do painting activities or play board games. I'd really want to know what is going to draw them back. And then again, that's going to be specific to whatever town I'm in. So I'm sure it's going to look differently when I'm in Copper, like what the residents in Copper want to do. That might look different than what West Point wants to do. And so after the launch, I'm going to be able to really tailor these socials to be for the community that is their for. Yeah, it's their event.
And if you run
Yeah.
into a bunch of seniors that want to learn how to do this stuff, we would
Yeah.
be glad to have them come down. We could set up a special time for you and
That's a great idea.
Yeah.
we will make it happen.
And at this event too, there is going to be a health education component to it. The first round of it, for this pilot series, I'm interested in focusing more on the why. So, like, what is social isolation, and why maybe they can help make this event be something that they feel like it's theirs. In the future, though, when I relaunch it, though, I want to have guest speakers coming in and share what their program does or what services they provide, and really get other subject matter experts in that can talk about specific needs. I'm hoping to keep that brief each time because I don't want the whole thing to be a seminar. The focus is going to be socializing. But in lieu of that, I'm always going to have a table set up in the back with resources. So if there's anything that you guys want displayed or prominently made available, I'll do that.
Dr. Smart did a really good group on men's health, and boy, the men showed up.
They showed up. Yeah.
And so he might be willing to do that again. And
Yeah.
there were a lot of good questions, and
Mm-hmm.
that a lot of time men don't ask.
Yeah. That's neat. I gotta find people after the pilot series, I'm gonna based on what they tell me that they want, create somewhat of a schedule. And unfortunately, I'm not gonna be able to, or it might not be possible always to have the same guest speaker go to all 4 socials, so there might be some variability in what's offered at them.
Mhm.
So far, I have been waiting to nail down all of the dates, which I have. And so today we shared this whole pilot on Facebook. So it's on our Facebook page if your agency wants to share it. But in addition to that, I'm giving this flyer that is a one sheet to businesses and agencies that can distribute them because it captures all of the event locations on there. But when I'm in San Andreas, I'm putting up a flyer that specifically focuses on just San Andreas. So it's a nice big one pager that just talks about San Andreas. And then I'm going to be doing the same thing in Copperopolis and Railroad Flat. And so there's going to be those out there. And people can take them and give them to their friends. I think that's the biggest way we're going to get it out, because not everybody's on Facebook. But I'm hoping that the people that are on Facebook could be the other service providers and then maybe family members of an older adult, to kind of to spread it out that way. But I do believe most of it's going to be paper.
I just have found trying to reach the people who are isolated
Yeah,
is very challenging.
yeah.
Because most of the time they don't want to leave their homes.
Mhm.
And so I tried to come up with different suggestions. Even for the senior center one time, I talked to Lucy and I said, what if we did like a movie night or something, and so I had her ask the people who came in and everything, and they're like, well, why would we want to come here when we can sit in our own home?
With our own comfy couch and our own snacks.
Yeah, so,
Yeah.
it's just very challenging, so.
It is.
I'm always trying to come up with ways to
Mhm.
try to reach those people who,
Yeah.
and so I'm hoping this really works for you in some
Yeah.
way. It's been such a challenge.
I think it is going to be a challenge, and I'm not expecting like a miracle overnight. But I'm hoping that by having the older adults really create this initiative from the ground up with me, that they'll have some investment in it and be proud of it, and then invite their neighbors and their friends to come and attend. So I'm hoping that helps.
Calaveras County only.
Yes.
So they can bring their friends, but just within the county, correct?